but we are certainly pleased to have on our live line our panelist, Wanda Petty, retired U.S. Army veteran, senior non-commissioned officer, and known as Sister Soldier, president and CEO of She Vet Inspired. Hi, how are you?
Hey there, Cliff. How are you?
I'm fine. Thank you so much for being with us. We have
Glad to be here.
absolutely Victoria Buggs, who is a RN, registered nurse, experienced and health and safety specialist with a demonstrated history of working in the hospital and health care industry. How are you? How you doing?
I'm doing great, thank you. How
Good.
are you?
I'm doing fine. We have a very important issue, obviously, right now to discuss with you ladies who have so much interest and uh, knowledge about this. Ways to protect yourself during the COVID-19. Everybody is doing that, and that's what we want to talk about. Staying safe during a pandemic crisis. Who wants to start off on this? This is something that is extremely important, and we, of course, will be expecting call ins to 312-374-8130. The topic is staying safe during a pandemic crisis. Why? Well, I'm not going to ask the questions because I'm sure many of our listeners will do this. But, sister, the African American population is being hit hard. It's being hit very hard. Is there a difference? Why are we not immune to being infected?
Well, I want to say first that our people have a myth. You know, we oftentimes think that we're not included in the population, but I think that we forget that we're human. And so our pigmentation doesn't exempt us from things like the COVID-19.
Mm-hmm.
And it's sad to hear that that one out of every death has been an African American, and so we're really starting to be hit hard from this pandemic, and it's important for us to know that we have to take the same measures as far as washing our hands and maybe creating, you know, we're really creative. We can create our mask. Most of us know how to sew, something of that nature. We're really domestic culture. And
What is
so,
your? Pardon me for cutting you for interrupting. What was the? What is the? How many of us? When you talk about how many people have passed, what are the percentages of African Americans? I missed that.
so the last number that I heard, like
Uh-huh.
yesterday, they used an example was 8,000 and 16,000 individuals that had passed, and then 8,000 was African American.
Oh, okay, 16,000, but 8,000.
Yeah, so out of 16,000, but now the numbers have grown and they're constantly escalating. So we're still carrying half of that torch.
I got you. Okay.
And so I just wanted to bring on Victoria because she's a nurse practitioner. She's an RN, an Army veteran, and she's been in combat. And so she's really passionate about saving lives.
Sure.
And I thought it was imperative for her to be on to share about some of the things to remind us as veterans and as a black culture and just as people as a whole, things that we can do to try to, you know, minimize the effect of on us and our families. And so I just really want to turn the floor over to her because I know that she has a plethora of information.
Great.
And thanks again.
Thank you.
Good evening. Good evening. Thank you, sister. Thank you, Mr. Kelly, for allowing me to come on the radio station tonight and give an opportunity to educate our people about the importance of staying sanitized during this critical time that we're facing. Number one, I would like to say that the African American people have a lot of comorbidities, morbidities, and they also have other health issues that increase their chances of not surviving the coronavirus. And that is due to a lot of barriers, in fact, societal factors that we have and that we've been going through. For example, access to health care, access to food, our living environment. Those are some of the reasons why we as African Americans are not staying at home. You know, they have to go out and work. We have to, as African Americans, supply food for our families and still go out. We are the essential personnel in our families, so we can't just call off. We can't stay home and shelter in place. So there's a lot of other factors going on here about the African American population that's dying out. The hospitals, the healthcare providers are not taking African Americans seriously when they come into the health organizations so they can seek help. They're waiting hours and hours at a time, being put on the back burner in certain areas and states. And when their time is up, they've already, you know, are on seconds of living. So I just wanted to educate the population on why it's important to stay sanitized in this time, and how to keep things clean and protecting themselves and using the protective gear that's been put out through the CDC and the World Health Organization. So the importance of being sanitized and why we should sanitize our living areas is because bacteria are microorganisms, meaning that we cannot see them with the naked eye. So we would have to use disinfectant agents. And again, some African Americans can't afford these type of things. Limited income, low income families can't go out and buy disinfectant from Clorox, $4, $5, $6 a little bottle of that to clean their house. But we can buy bleach. So keeping your home safe, washing down your doorknobs, dusting, wiping down your window shields, wiping down your front door, things of that nature will help reduce the spread of transmittable diseases. Keeping your bathrooms clean, watching who comes and goes from your home, ensuring they wash their hands with soap and water, not just with hand sanitizer, but with soap and water. These are specific ways to keep and prevent from spreading the coronavirus. As they're out in the community, making sure they keep their hands gloved or a mask on their face. Just recently, they came out a couple of days ago about the cloth mask. It's been all over the news about how to make those at home since the government is not supplying them for families. They put on several YouTubes how we can make our own masks. Now, would this be a problem for social economic families? Of course. So they're saying, oh, you can use a bandana. This is the type of material you use. Here's another factor. Here's another barrier, because some people might not have that. So now we have to come up with something or use different resources to get these people, again, essential personnel, the preventive equipment that they need.
Now, did you say a cloth mask?
Cloth mask, sir, yes.
Cloth mask, okay. All right.
So in this time, the mask is supposed to protect us from the other person who might be infected but are not showing signs of the coronavirus yet. As we know, that the coronavirus may be asymptomatic for some people. So right
now
now, there's
explain that. Explain what you mean when you say asymptomatic.
so asymptomatic means that they have it, but they're not showing any signs. Their fevers are not high. They're not coughing. They're not showing any type of respiratory problems, but they're carrying that virus.
Gotcha. Okay.
So these are preventive measures of the cloth mask, and what the government has suggested, and the CDC and the World Health Organization for us to protect ourselves from. Any questions that you have before I go on?
No, if somebody has a question, please call in 312-374-8130. Go right ahead.
Another question that I had was, should we wear masks inside our homes? I believe that you shouldn't wear masks inside your home unless you have several people residing in the home with you. If you're by yourself, of course, you wouldn't wear a mask by yourself at home if you're just the only person or the sole person there. Mm-hmm. But as far as having multiple people stay in the home, I will recommend limited access to the home. If we're sheltered in place, make sure they go out with the mask and gloves, come in with the mask and gloves, dispose, wash your hands with soap and water. But for right now, in multiple states have been given, the governors of multiple states have been given the order to the community to shelter in place, to stay at home. Not everybody can do that, but for those that can, it should be a priority. You should make that your business to go out, especially if you're to stay in if you're an African American.
That's an interesting comment. You said shelter in place. What exactly does that mean? Shelter in place.
Stay where you are.
Stay where you are.
Stay at home. Stay where you are. A lot of people have. If you're that type of person that's used to going out and being out in the community, it's very hard to stay at home. If you're a community advocate, if you're a church provider that's always checking on the elderly, and now you have to shelter in place and stay at home, and you're no longer an essential personnel, that's very hard. So we have to find out ways, if you do something, find ways to continue to social distance yourself. If you have to bring food to someone's home, drop that bag off on the porch and let them know that you're there. But going into somebody's house, staying there communicating with them, wouldn't be a good idea. And those that are sheltering in place should stay at home. Go out in your backyard, play out there, take a walk to the corner, but do not go in the stores unless you need to. Do not just hang out, be hanging out within the community, because it's not safe out there. The person that you're shopping with may have that coronavirus that you don't know. It's a lot of people out here. As of today, I had to stop at the store. As of today, I've seen multiple people without masks on today.
Sure.
Multiple people without gloves on as they were pushing the cart. Multiple people. You know, and that was very disturbing to me. Hopefully they got home and washed their hands and did what they needed to do before they contaminate their family or their loved ones.
Our call-in number is 312-374-8130, and we have a caller. John, thank you for calling.
Hello, can you hear me?
Yeah, thank you, John.
Okay, first of all, everybody out there listening, thank you very kindly, and have a nice holiday, number one.
Thank you.
Number two, to piggyback on exactly what this young lady said, my friend and I had to go to the store. The only reason I ever go out now is to the store and or to the hospital for medical reasons. Now, in traveling to the store, we're on the 151 bus, which goes through Lincoln Park, and that park was filled with people from Diversey on the north to North Avenue on the south, and there are not any police officers bothering them or harassing them or telling them to go home. And I have heard from people who have said that the police are bothering people on the south and west sides of Chicago, but yet all of these people in the areas of Lakeview, Lincoln Park, and the Gold Coast, because these are these over-gentrified areas with 99% Caucasian people. They were not being bothered by the police, and they're running around footloose, fancy-free. There were people playing baseball or, some sporting activity.
Wow.
The baseball diamond. There were people over by North Avenue and Lakeshore Drive. There's a volleyball court over there, and they were playing volleyball. And people were just congregating all throughout Lincoln Park on the north side of Chicago. And this is happening all the time. And, people
Well, are the
violently...
police bothering them or anything? What?
No. The police were not doing anything.
That's what I thought you said. But these folks are risking their. Are they covered at all?
No.
Do they have?
Some of them had masks on. Okay. But what I am saying is, that social distancing of 6 feet, etc., and more, they were not observing this. A lot of them. It was just like a regular summer Sunday in the park, and these people are jogging around.
Well, if that's what they want to do, John, I wouldn't do it, but I guess that's up to them to determine it. It's just, I guess. I can't think otherwise. It doesn't make much difference what they're doing. Let's go take another caller. Dr. Lisa, hi. Hi, Dr. Lisa.
Hi, Cliff, and hello to your guest. I wanted to piggyback off of what she was saying. And as far as wearing gloves when you go grocery shopping, some people don't have access to gloves. So what I've seen in a lot of the Walmarts that I know is kind of wasteful is people take the fruit bags, the bags that you put the fruit and groceries in, and they use that to wrap around the handle of the cart after they clean it with the Purell. Hand wipes that they have in all of the stores. Another thing you have to look at when it comes to wearing a mask in your own home, do you have someone in there that's compromised? My mother has COPD, lung cancer, and I have asthma. So therefore, in my house, if I'm around my mother, because I am a nurse, when I go out, I feel the need to wear a mask in my own house because I need to make sure my mother's okay. Mm-hmm. And so, that's something that needs to be taken into consideration. And one more thing, there's a family here on the west side. Everybody has been exposed because they all live in the same building. And so, therefore, that's where the mask, the hand hygiene, and distancing can come into place at. So, it's a lot of things that a lot of people do not take into consideration, and it could be lack of knowledge or it could be several factors, but we all have to think about this. And, when I just got finished working and I sat at my patient's house for 8 hours with a mask on, he didn't have on a mask, but I had on one.
And your mother's lucky that she has a daughter who is a nurse. That's great. Let's go to Derek. Derek, thank you for holding.
Yes, sir.
Mm-hmm.
I'd like to know, I was in my backyard this morning. I'm painting my tool shed, and I'm working on windows in my garage, and my neighbor came out and told me it's not safe to be doing any kind of work outside. Is that true? Should I listen to that kind of talk?
What about that?
As long as you was working by yourself, I personally don't see anything wrong with it. I don't think that right now they're saying that the air is carrying the coronavirus or what you're inhaling is an issue. I'm not for sure. I haven't heard anything about that. And maybe if any other callers can come in and let me know, but I haven't heard anything that restricts you from going outside, working within your home area. Not at all, sir.
Well, I'm glad to hear it. Thank you.
All right. Thank you so much. I tell you, it's going to be a very interesting situation as we hopefully see people do better and better. Right, ladies?
Exactly.
Yes, most definitely. Most definitely.
Mm-hmm. Yeah.
So I have a website. They were having problems with African Americans being able to get to obtain some masks. But here's a organization that's serving the African American population, and it's retailformail.com.
Okay.
And they have the mask. You can buy them in bulk, and it's you'll get them a lot quicker than you will on Amazon.
All
So I
right.
just wanted to just kind of share that because it's important.
Sure. it
And
is.
and
Yeah. All right.
I know that some people may not be able to afford it, and just take the advice that was given to by Vicky to maybe do the best that you can and make something by hand and just
Right.
protect you and your family.
Mhm.
But this is an option that is available, and it's the N95 mask that is available for specifically trying to reach the African American community.
I want to thank you both. Excellent information. Thank you.